Good evening, Matt Wordsworth with ABC News. It started as an easily treatable leg infection, but within 2 weeks, a series of compounding errors resulted in the death of Manus Island detainee Hamid Khazaei. Those are the findings from the coronial inquest into the death of the 24-year-old, which also painted a damning picture of the level of healthcare given to inmates in offshore processing centres.
Anger and pain over the fate of 24-year-old Hamid Khazaei, the Iranian asylum seeker who was in Australia's care and did not have to die.
Mr Khazaei's clinical deterioration was recognised and responded to in a timely way at the Manus Island Regional Processing Centre Clinic, and he was evacuated to Australia within 24 hours of developing severe sepsis. He would have survived.
Mr Khazaei's death in 2014 has been ruled entirely preventable, the result of compounding errors. It started on Manus Island with a simple leg infection, but doctors at the detention centre's clinic did not have the right antibiotics. Their request to transfer Mr Khazaei to Australia was knocked back, and when he was eventually moved to Port Moresby, he was so sick he needed intubation and resuscitation. That also did not happen. By the time he arrived at Brisbane's Mater Hospital, the young man was brain dead after suffering several heart attacks, organ failure and severe sepsis.
The health care he received on Manus Island was not commensurate with the care he would have received in a remote clinic in Cape York. The benchmark applied in this matter.
Nothing has changed since this entirely preventable death, and if anything, things have just become much, much worse.
The coroner has recommended the Home Affairs Department instigate major changes, including that clinicians on the ground in detention centres should have the final say when requesting medical transfers for patients, and the department should commit to having independent investigations for every detainee who dies in offshore processing. In a statement, the Home Affairs Department has extended its condolences to the friends and family of Mr Khazaei. It says it's still reviewing the coroner's recommendations.
The death was preventable, and I think that says everything that we need to know about the circumstances that people have been sent to Manus Island and on Nauru.
The coroner found the best way to prevent similar deaths is to bring asylum seekers to Australia or New Zealand, where better healthcare can be provided. But he acknowledges that approach is unlikely. Alison Horn, ABC News, Brisbane.